my name's Brianna. I'm going to be your nurse today. Can you tell me your name and your date of birth?
Maureen Baldanza, July 15th, 1966.
Okay, and I'm just going to check your ID band here. Maureen Baldanza, 7/15/66. Very good. What brings you in today, Maureen?
I feel like I'm getting a cold.
Okay, we're going to do your vital signs first, and then I think we'll do a head-to-toe assessment and see if anything is out of range, okay?
Okay.
Can you step on the scale here for me?
Sure.
And how tall are you, Maureen?
5'1".
5'1" and 145 pounds. Okay, you can have a seat. I'm going to check your heart rate, your oxygen saturation, and your blood pressure, okay?
Okay.
And your temperature. So, put this on your finger. And your temperature. 98.3, very good. And we're going to do your blood pressure. (110/75). Your heart rate is 69 and your oxygenation is 96%, all within normal limits. Okay, so first we're going to assess your level of orientation. Do you know where you are?
I'm in the hospital.
Okay, and what year is it?
2021.
And who's the president?
Joe Biden.
Very good. So we're going to assess your memory. I'm going to tell you 3 words, and I want you to remember them the best you can. I'm going to re-ask you them at the end of the assessment, okay?
Okay.
Scissor, hair, nail, okay?
Scissor, hair, nail.
All right, I'm going to ask you again at the end, okay?
Okay.
So we're going to begin the head-to-toe assessment now. I'm going to be starting with your head, okay? So I'm palpating for any bumps, lesions, or abnormalities, any infestations. Head appears normocephalic and hair is growing in a normal growth pattern. I'm going to be assessing your cranial nerves now, okay? Where there's 12 of them, and we're going to start with number 1, which is your sense of smell, your olfactory nerve, okay? So I'm going to run something underneath your nose, and I want you to tell me what it is, okay?
Vanilla.
Very good. And now we're going to do cranial nerve 2, which is your optic nerve. I want you to stand over there on the blue line that's 20 feet away, and we're going to assess your vision, okay?
Okay.
So you're going to read from the lowest line that you can,
Number 8.
okay?
DEFPOTEC.
Good. Cover your right eye.
DEFPOTEC.
And your left.
DEFPOTEC.
Very good. You can have a seat. And now we're going to test cranial nerve 3, which is your pupillary response, okay? Good. Good. I'm going to assess your conjunctiva, which is pink, and your sclera is white. I'm not noting any drainage or anything oozing out of your eyes. We're going to assess cranial nerves 4 and 6 now, which are your trochlear and your abducens, okay? So I want you to follow the pen light. Good, follow it in. Very good. Pupils are equal, round, reactive to light and accommodation. So now I'm going to do cranial nerve 5, which is your trigeminal. It's going to test your chewing, okay? So I'm first palpating your temporal artery, which I note as 2+ bilaterally. And your masseter muscle, can you bite down for me? Good, open your mouth, close, against resistance, good. I'm also going to assess your lymph nodes while you're here. I'm checking your preauricular, your postauricular, your sublingual, and I'm not noting any abnormalities there. Okay? Now I'm going to assess your cranial nerve 7, which is your facial. Can you smile for me? And can you frown? Good. And puff out your cheeks? Very good. All right, we're going to assess your cranial nerve 8, which is your hearing, okay? Your vestibulocochlear. I'm going to whisper a word into your ear while you cover the other one, and you're going to tell me what it is, okay?
Okay.
Okay, cover your one ear. Pillow. Okay, and the other one?
Tissue.
Good. Okay, and now we're going to use the tuning fork here, okay? And we're going to assess your sense of hearing. You're going to hear a buzzing sound, okay? I'm going to place it in 2 places, A and B, and I want you to tell me which one you hear louder, okay?
Okay.
So face straight forward. This is A and B.
A.
Good. A and B.
A.
Good. And now I'm going to hit the tuning fork one more time over your head. I want you to know, is it louder in your left ear, your right ear, or both ears equally?
Okay. Both ears equally.
Very good. So now I'm going to move on to cranial nerve 9, which is your glossopharyngeal. Can you open up your mouth? Good. Mucous membranes are pink and moist. And I want you to say, ah.
Ah.
Good. Gag reflex is present. Also going to check cranial nerve 10, which is your vagus nerve. This is your swallowing reflex. Can you swallow for me? Good. Any pain or difficulties there?
No.
No. And I know that cranial nerve 10 is working because your speech has been clear all the way through the assessment. Okay. Now we're going to move on to cranial nerve 11. Can you shrug your shoulders for me? Good. We're going to do it against resistance. Very good. Can you look left to right? Any difficulties there?
No.
No. And now I'm going to do cranial nerve 12, which is your hypoglossal. Can you stick out your tongue?
Ah.
And move it left to right? Very good. So that is all 12 cranial nerves, okay? Everything seems within normal limits. So I'm going to move on down to your neck. I'm looking for any bumps, lesions in here. And I'm going to palpate your thyroid gland and your trachea. Any problems?
No.
Okay. I'm also going to auscultate to your carotid arteries, okay? Good. I'm not hearing any bruits or any abnormal sounds. I'm going to listen to your lung sounds now, okay? Nice deep breaths. Very good. No wheezing or any adventitious breath sounds. Breath sounds sound clear and vesicular bilaterally. Listening in the back as well. Good. I'm going to listen to your heart now too, okay? We're going to listen to your aortic, your pulmonic, tricuspid, and your mitral. Okay. I'm hearing regular rhythm and S1, S2 heart sounds, okay? I just wanted to let you know too, we've been assessing your skin all the way through the assessment so far. I haven't noticed any edema, swelling, or anything like that. Is there any rashes or anything that you wanted to make note of before I move on?
No.
Okay, so I'm going to assess your abdomen now, so I want you to come over to the couch. Any nausea, vomiting, diarrhea recently, anything like that?
No.
Okay. So I'm seeing a nice flat contour, no awkward pulsations or anything like that. Skin appears appropriate, even in tone and color. I'm going to auscultate your vowel sounds, starting with the right lower quadrant, and we're going to move clockwise. Very good. Vowel sounds are present in all 4 quadrants. I'm going to do some light palpation now. You tell me if you have any pain or tenderness. Anywhere I touched?
No.
And now I'm going to do deeper. Very good. Okay. You can sit up. So now we're going to test your sensory function, okay? So I want you to hold out your palms. I'm going to put an object in each of your hands, and I want you to try to tell me what it is with your eyes closed, okay?
Okay.
Okay.
A key.
Okay, and this one?
A ring.
Very good. You can keep your eyes closed. I'm going to write a capital letter in each of your palms, and I want you to tell me what letter it is, okay?
Okay. L.
Good?
P.
Good. And now I'm just gonna do a 2-point discrimination. You're gonna feel some pinpoints on your on your palms, and I want you to tell me how many different points that you can feel, okay?
Okay. 2.
Good.
3. 2. 2.
Good. The other palm?
1. 2. 3.
Good. Okay. So what we're going to do now is we're going to test your cerebellar function. The cerebellum's in the back of the brain, and it helps with coordination and balance, okay? Have you been having any difficulties with that
No.
recently? Okay, so I'm going to have you stand up. I want you to close your eyes. We're going to do something called the Romberg test, okay?
Mhm.
So first you're going to stand like this. Do you feel off balance at all in this position?
No.
Okay, I want you to close your eyes. We're noting for any swaying or anything like that. Very good. Can you walk normally for me now? Good. And you're going to walk on your heels and your toes and like you're on a tightrope. Good. Any difficulty with that?
No.
Okay. You can have a seat back down. What we're going to do now is I'm going to hold this pen light. We're going to test your rapid movement skills, okay?
Okay.
So you're going to touch your nose and then you're going to touch the pen light, okay?
Okay.
Okay, go ahead. Nose, light. Nose, light. Good. And the other hand? Good. One more test for this. I want you to sit back. You're going to take your shin and run it down your heel, okay? Good. Any difficulties with that at all?
No.
Okay. We're going to be testing your reflexes now, but before we do that, I just want to check your pulses, okay?
Okay.
So we're going to feel the radial ones. 2+ bilaterally. 2+ bilaterally. I'm not seeing any edema, redness, anything like that. I'm going to check the back of your knees here. Good. Pulses are even, and we're going to check your pedal pulses. Nice and even. I'm not seeing any edema on your feet as well. Very good. You can have a seat here. And we're going to assess your reflexes, okay?
Okay.
I'm going to do your radial first. Relax. Good. And your biceps. Good. Triceps. Good. And now we're going to do the other side. Radial. Biceps. And triceps. Good. I'm going to assess your patellar now. And your Achilles. And the other one. Good. Reflexes are all normal. No hyperreflexia noted. Do you remember the 3 words by any chance that I told you?
Scissor, hair, nail.
Very good. Okay. Do you have any other questions for me right now, or anything you want the doctor to take note of?
So everything is fine.
Everything from my standpoint is in normal limits. You might need something for cold, like you said you came in with, but the doctor will be able to prescribe that for you, okay?
Okay, great. Thank you.
All right. I'll go get the doctor.
Thank you.